Welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban, and we have a fantastic episode for you because we're talking about skincare, super relevant, and more importantly, it's the fifth of a five-part series here with Charlene, my fantastic aesthetic nurse. We, as many of you know, we opened up a new wellness center, a med spa called Restore by Rahban MD that Charlene is heading. And I really wanted people who are out there, because this is what I did, in order to open up this spa, which everyone who follows me knows I hate spas, because I hate spas that are unmanned by a clinical person who really is curating the things that are offered to make sure that what they're offering is really in the best interest of the patients. So historically, spas are, they're sort of on an island. There's a medical director. That medical director shows up once in a blue moon. More often than not, the medical director has no expertise in aesthetics. They're an OB or a pediatrician or an internist or an ER. They're just using their license. And by and large, the nurses are doing whatever they need to do or want to do. Could it work? Sure, but I don't think that's ideal for patients. So when we decided to open ours, I wanted to make sure anything we did was like awesome, or you know what, we don't need to carry it.
Absolutely, yeah.
So the 5 areas we talked about: neuromodulators, Botox, for example, fillers, Restylane, for example, lasers, which is so cool and we're excited about, like our Cyton Halo or our BBL, microneedling, which is probably the best thing we offer in the entire space and the most simple, and now and last is skincare. And anyone who knows me also knows that I'm all about simple, stupid. I'm all about anti-marketing, nonsense, selling people things like a $500 jar of La Mer that probably does nothing because it's Vaseline. Like, I'm all about that. So when it comes to skincare, what we wanted to do is really break it down for people. So when they go to buy things, they can buy things that hopefully help them and avoid things that probably do nothing for them and it's just a waste of money. So Charlene has a lot of experience in skincare. I have very little experience in skincare, but I know enough to know the basics. So the first thing is that if your skincare is not medical grade skincare, I humbly suggest you throw it in the trash. What does that even mean, Dr. Rahban? So for skincare to do anything, whatever it's supposed to do, it has to have active ingredients. That means ingredients that actually do something, right? This is a cream that's supposed to lighten your skin. This is a cream that's supposed to get rid of wrinkles. This is a cream that's supposed to, so it's supposed to do things. So it needs an ingredient that actually works. With medical grade skincare, because it has to be prescribed or given to you by a doctor, the ingredients in there are higher quality, more concentrated, and therefore are more likely to do what you're asking it to do. Well, Dr. Rahban, it's just so much more expensive. Lie. Total lie. How much is a jar of La Mer?
Oh, way more than any of the skincare that we.
It's bullshit. It's you go into Neiman Marcus right now and you go behind the counter and they have some of the foofiest perfume-driven, nonsensical skincare, but they have great advertising and great packaging. We have the overwhelming majority of products, skincare, high-end skincare we sell is like $50 to $100. That's like nothing. So the most important thing I want you to listen to at home is we're not selling you Rahban cream. I'm not private labeling my cream and sending it to you. I'm telling you that if you're going to use skincare, you're going to go through all the trouble, put it on your face, make sure it has active ingredients. And the best active ingredients are medical grade active ingredients, which means you want to get it from your doctor. That's number one. The second thing is that you want to really create a protocol that you're actually going to do.
That you stick to, because consistency is key.
Right. So very, very common is you go to a dermatologist and you walk out with like a bag. And in that bag is like 8 items. You do those 8 items for 2 weeks, and then those 8 items become 5 items, and then they become 3 items, and then you're barely putting on sunscreen.
Or you use it for 2 weeks and don't see a difference, so you stop using it.
Right. So that's a great point. We'll get to that in a second. So do not even begin a skincare protocol you cannot continue for 10 years. So if you do an 8-step process, like my wife, and do it consistently, your skin will crush it over someone with a 5-step process. But if you do a 8-step process and only do it for a month, then you're better off doing a 3-step process for a year.
Yeah.
The next thing is skincare is a long haul. It is not, and I underscore, designed to show you anything. You are not supposed to put skincare on and in a month from now look in the mirror and be like, well, I don't see anything. You're not supposed to see anything. It takes years of commitment. But what it does do is incrementally and gradually, in conjunction with Botox, in conjunction with microneedling, in conjunction with the BBL once in a blue moon, in conjunction, you're going to go to work, school, friends, events, and be like, shit, Charlene, you look pretty good. Thank you. I know it's my skincare.
Yeah, absolutely.
So that's the second thing. So what we want to do is, Charlene's going to give you what we recommend is basically what we call your core skincare. Like if you're not going to do anything, but at least do these things, here are the things that she recommends. So write them down. What are they?
So I like to simplify my skincare because I'm one of those people that if it's too much, I'm not going to do it. So I like to really simplify it and use ingredients that work and make sure that I stick to it. So you always want to start off with a very gentle cleanser, maybe exfoliate twice a week just to kind of remove some of the dead skin cells. During the day, you're going to use a vitamin C serum. And the vitamin C serum is really, really important because it protects your skin from the sun and the UVA and UVB rays, but also help prevent free radicals as well. So all of the pollutants in the air as well too. So it'll really do a lot of protection for your skin.
Okay.
Gentle moisturizer, nothing, no frills, just a gentle moisturizer that's going to keep your skin hydrated. And then sunscreen during the day. Nighttime, we're keeping it just as simple. Instead of the vitamin C serum that we're using in the day, we're replacing that with a retinol cream. A retinol is the only thing that's going to help turn over your skin cells. So it is very important that we use it. A lot of people get discouraged from retinol because they get, their skin gets sensitive, it gets red, irritated, peely. But the thing is, that's all of the dead skin that you're trying to remove so that you can get these new skin cells. So you have to go through that process so that underneath all of the new skin is going to go peel through. So you do have to be consistent with it and work through that space. But once you hit that peak of maybe about 6 weeks of all the peeling and redness and irritation, your skin's going to do beautifully. And then just with a mild cleanser and moisturizer at night. And that's easy.
So I'm going to break it for you guys again because I'm the type of person that likes things spoon-fed to me. So number one is your skincare should have a daytime and a nighttime component because what's happening during the day is different than at night. So the daytime is you need a gentle cleanser. I am cleaning my skin. It's dirty. Why is it dirty? Because you've been out and there's literally soot in the air and you go outside and your car's dirty after a day. It's got shit in the air. So cleanse it. Every once in a while, as Charlene said, maybe twice a week, gentle exfoliate. If you are too aggressive with your exfoliation, you will get inflamed and irritated. So a gentle exfoliation. Next, your skin doesn't do well dry. It's alive. It's an organ. So some moisturizer. Then you need vitamin C. Do you put your vitamin C on before the moisturizer?
I do it before my moisturizer.
So wash. If it's your day to exfoliate, exfoliate. If not, put a little bit of the vitamin C serum. Let it soak in. Put a little moisturizer.
Sunscreen.
And then sunscreen. If you don't add the sunscreen, don't leave the house. Don't bother. Now, the key to sunscreen, you need to repeat it every 3 to 4 hours. If you don't, it doesn't work. 9 out of 10 people are like, I'm religious about my sunscreen. Really? Great. I put it on every morning. And what do you do in the afternoon? What do you mean? It's gone. It's zero. It's doing nothing. So it's every few hours you need to have it and put it on. Now, anything we tell you to do is relative to your skin. Some people are sensitive. Some people are not. Some people try this brand and it causes them irritation, and they try that brand. Skin is very picky and particular. It doesn't mean that the formula doesn't work. It means the ingredients you're selecting haven't been chosen for you, and we'll get into that in a second. So that's your daytime. Got it? Easy. Then you get home and it's nighttime. You wash the shit off your face because it's dirty. You don't exfoliate it in the evenings, right?
If I need to. I mean,
But
if it's
generally,
nighttime,
it's
yeah.
right. The exfoliating you do twice a week, usually do in the morning, yes?
Just depends, honestly, when I remember to do it.
Okay, but let's give people a very strict concept.
Yeah.
Would you rather them do the exfoliating in the nights or in the mornings?
I think I'd probably do it at night.
Okay, so try to do your exfoliating that when you do it at night so that your skin has time to relax from exfoliating. Then instead of vitamin C, you're going to be using retinol. So I just want everyone to listen. If you're never going to use any ingredient except for one ingredient, the only ingredient, the only real active ingredient is retinol. Did you hear me? Retinol is the only active ingredient that is critical because it actually thickens your skin. It's been around for 60, 70 years. It is the cheapest, most basic, most revolutionary drug, and you need to use it. Now, retinol, because it is the most active ingredient, has the most problems with it, right? So let me explain something to you. If you put something on your face and nothing happens, it's shit. If you put something on your face and like a lot happens, it's active.
Yeah.
So retinol is something you must play with. So Laura, my wife, puts retinol on. She looks red and flaky. I put on retinol and I look like nothing happened. I can put a quarter-size piece of retinol on and nothing will happen to me. And Laura will put a pea-sized retinol and she will peel like it's like no one's business. Therefore, you must experiment. Use less of it. Give it a day a break. Play with it until you get into a rhythm. And once you're in a rhythm, your skin will be very, very happy. And then you use the retinol till the day you die. And that is the one thing when I see patients and they're like in their 60s and 70s and they come in, I'm like, wow, you look good. What have you been using? Oh, nothing, just Retin-A. So again, clean your face, exfoliate at night, a dot of retinol until you figure out what the right amount is, moisturizer, right?
That's it.
And go to bed. So this core is really, if you are able to do this core 90% of the days that you go out, if I were to see you in a few years, you'll look fantastic. Now, there are special things that we can add to help certain people with certain issues, but this stuff we just told you is the mainstay. This is this sort of the baseline foundation of what you need to do. So what are some of the sort of, oh, you have this problem? Then add this for a while till you improve it. Oh, you have this problem? Then add this. So go ahead. What are the different ones?
Discoloration's a big one. So if you have tons of discoloration, you can use, hydroquinone or some non-hydroquinone brightening serums to help even out your skin tone.
So number one is, if in addition to everything we told you, you have a ton of pigment, right? Sunspots, etc. You A, want a microneedle. You B, must do one of our lasers. And C, you will use some of these creams. Together, your sun damage will be significantly improved. In and of itself, the creams definitely help, but they're all part of a bigger scheme. And when it comes to sun damage, not, oh, I'm a young person, I barely have any. I'm talking about like a 50-year-old like me. It's a multi-pronged approach that helps, but we have creams that help you with sun damage. There are two main categories. Hydroquinone, like retinol, is a drug that's been around forever and it's very effective. But you can't use hydroquinone like a retinol every day. After 3 months, kaput, no more, zero. And you have to then switch and give your skin a break to non-hydroquinone based lightening creams. And they have different ingredients and they do different things. So that's one area. Pigment, there's creams for that. What's another area?
Rosacea, redness.
Rosacea.
So you can do calming serums to help fight off, the sebum that's created from and makes rosacea. So
Right.
it can
So
really help.
we have, in addition to my foundation, I have some pretty bad rosacea. Great. We have certain skincare that will help target that rosacea. What else?
Acne.
So acne. That's a big one for me, not because I ever had acne. On the contrary, I never had acne. But my nephew had acne, my niece had acne, my wife had acne, and it can ruin your life. So acne is predominantly about oil control
Yes.
and cleansing and keeping those oil glands unclogged, open, and clean. Keep the drainage going.
Yeah.
So what do you suggest for acne?
We have exfoliants like alpha hydroxy acid and beta hydroxy acid to help peel the skin, help control the oil production. Tretinoin or retinols are great for that too. As long as you're kind of just following, the proper skincare and helping control the oil, you can.
So an interesting thing is for acne, in addition to baseline stuff, we have two things that I think make a huge difference and are game changers. One is lasers.
Yeah.
Why? What does lasers have to do with acne? It's bacteria. And when you move a laser over an area that has acne, there's so much heat that goes through there that it kills all the acne. And it's not going to prevent future acne, but it's certainly going to address active acne.
Yeah.
And so if you have active acne that you just can't get ahead of, and you can't wrap around it, and you have to go to an event or it's a wedding, certain lasers at low doses of heat will cause that acne to, at the moment, go away. The second and by far the most effective treatment for acne is Accutane. And Accutane is a phenomenal drug. Phenomenal drug. And the biggest issue with Accutane is because, again, the more active the drug, the more issues that happen with it, and you have to dial it in. And historically, people took really high doses of Accutane, and it had side effects.
Yeah.
For example, joint pain, issues with their eyes, dryness, et cetera, et cetera. But the way to take Accutane is lower doses, longer period of time, and it can almost cure, in many instances, acne. And the key is to get at it early before all the scarring has occurred in your face and your back, because acne scars are almost, no, I don't want to say almost, they are irreversible.
Yeah.
They are
you can
forever.
Make them look better, but
you have it forever.
You don't get rid of them.
Yeah, so that's that. What other skincare stuff and what other any categories of stuff that there is?
I'd say that's pretty much it. Everything else is kind of, just really, I don't know, not really even needed.
Right. So listen, if you're a skin connoisseur, as is the case with my wife, you'll try a million other things. But if you are a person, which is 98% of people, that barely even puts on SPF, but you really want to do something for your skin, what we just said to you is more than enough. Yeah. If you do the morning routine and you do the evening routine and you happen to have some of these other issues and you dabble with those things, I think you'll be over the moon in regards to the outcomes. So the question then is, everyone's asking is, okay, great. What skincare? Yeah. And the truth is that in most of the medical grade, that is the skincare that I have access to, and Dr. Smith has access to, and Dr. Johnson has access to, most of those skincare companies are pretty good. Now, like when we talked about filler, we're biased towards Restylane. Like when we talked about neuromodulators, we're biased towards Dysport. We have our biases in regards to skincare. We carry pretty much Zeo and Skin Better, right? And Charlene, who has vast experience with skin, has decided that's what we want to carry. And what was the reasons for each of those? Why your preference on one or the other?
Zeo has one of the best medical grade skincares, especially when it comes to corrective, any sort of corrective things that we need to do for patients' skin, whether it be melasma or rosacea or even acne. So they have just great active ingredients for that. I love it on correcting skin or for maybe older skin types. And then, Skin Better is just a very basic, product that or line that really just creates these products that just work and are effective and are very minimal, but do a great job.
Yeah, so I think what you had told me originally is I like the skin better for young patients who have good skin that want to maintain it, and I like ZO for more mature skin, aka 40s and 50s and on, where they have issues that we're addressing. So we try to address it. Will I one day have a private label? Probably not, unless I felt that we were creating something that is equal to and or better than what's out there. So when you go to your doctor's office and it's like Dr. Rahban's cream, I don't know, you better make sure that that's better than ZO.
Yeah.
Right? Because at the end of the day, what's in it? I don't know, but Dr. Smith recommends it, or Dr. Rahban. I love Dr. Rahban, but that's not what I would do. I am a little bit suspect of private label stuff by doctors, because I think when we're talking about super high level medical grade skincare, I don't know that I myself has access to the chemist that, say, the ZO company does.
Yeah.
Take it for whatever it's worth. We have one last thing that we never talked about that we definitely need to talk about. We didn't talk about it on the laser side, and we definitely have to speak about now, is melasma. I mean, we just left melasma out altogether. So if you've been listening to our 5-part series, when it comes to lasers, pretty much melasma is a do not touch that patient. Just don't touch them, don't touch them, don't touch them. In general, patients with melasma, the answer is don't touch them, period.
Yeah.
Because everything you do to a patient with melasma makes their melasma worse. So on the laser side, it's like forbidden. But we now have the halo, and the halo really is again revolutionary in the idea that you can actually treat someone with melasma with a laser with heat. It's just like sort of unconscionable. Like, I can't even believe that. So that's amazing. But on the skincare side, there are some really incredible, ZO has some things specifically that is targeted towards melasma. Now, patients with melasma are always going to be frustrated.
Yeah.
Because it's hormonal, it's what you eat, it's coming from within. We may do all these things and you're 20% or 30% better.
It could just come back or get worse.
But I do think that it's a good time to have melasma as opposed to 10 years ago.
Oh, absolutely.
I think there are definitely things that we can do to make it better. And for some people with, like my sister, with terrible melasma, any improvement is improvement.
Absolutely.
Wouldn't you say?
Absolutely. Yeah. Historically, we couldn't treat melasma in the past, and if anyone ever said that you could treat it with any sort of lasers, I would run because you couldn't. But with the new addition to the halo, it's exciting because we can treat those
So, but if you have melasma and you're going out to get, do not go get a laser. 1,000 times worse. You got to make sure it's specifically a laser. Google it, ask for the name of the laser, Google it, and make sure it works with melasma. All right, guys. Well, that's our last of 5 episodes. I hope you enjoyed them. Charlene and I have tried to kind of take you through a systematic approach through the services that we provide. We do other things like PRP to the scalp for hair loss. We do PRP or PRF injections. We do all kinds of other things, but I think these 5 things are the core of what I think patients have available and that work, and that together in conjunctions with what we offer surgically are enhancive. All right, guys, I hope you enjoyed it. That's a wrap. We're going to go ahead and call it. 2 things before we finish. 1, do me a favor. You enjoy the show, you find it entertaining, educational, what have you. Go write a nice review right now. Literally put down this, once I go cut, go write the review right now, because at the end of the day, it really helps us a lot. A, it makes everyone feel good about what we're doing, and 2, it boosts our ranking, and at the end of the day, we want as many people to hear what we have to say as possible. The second is share our podcast with the people you love, your friends, your family members. What you don't want to see happen is they have a complication and you're like, oh shit, that's what Dr. Rahban said last week. Well, it's too late, no help now. So that's it. All right, guys, we're going to make it a wrap. We'll see you guys next week on Plastic Surgery Uncensored. I'm Dr. Rahban signing off. Bye.